The colon cancer screening program has kind of been rejuvenated. What makes it so unique is that it takes very little effort on the part of the patient, very little effort on the part of the primary care physician, very little effort on the part of the endoscopist. We do all the work. The patient is hand-walked through the program from the very beginning, from the first time we talk to them on the phone. We give them what I call the Encyclopedia Britannica version of what they're going to experience so they don't have any surprises. What a patient navigator is someone who basically holds the hand of the patient from the very beginning, from the moment we talk to the patient on the phone, that we navigate them through the system that they have to go through to get their screening colonoscopy. There's a matter of getting their history, their personal medical history, surgical history, their family history, and as far as the prep is concerned, do they have any kidney problems? Do they have any heart problems? And so we want to make sure that there's a prep that they can use. We have patients that are diabetics who have to take insulin. What do they do when they're going without anything to eat for a solid 24 hours? But I don't think there's anything that handholds the patient like we do, that elaborates like we do, that gives the patient as much detailed information and as much support 24/7 like we do at Jewish Hospital. We are unique and we're excellent. We provide excellent care.
Great.
Some of the questions are, do I have to really drink a gallon of that stuff? Does it really taste like the ocean? Am I going to get sick? Am I going to be okay going without food? What about if I'm diabetic? How much is this going to cost me? Because I don't have the money to pay for something like this. Do I really have to have this done just because I'm 50? There's nobody in my family that's ever had colon cancer. And what's so nice is these are all questions that are, they're perfectly justifiable questions, but and it's an honor to me to be able to answer those, because so many times people are reacting just because they don't know. And so I don't believe that there's such a thing as giving a patient too much information, especially with something like this, because when they come through completely relaxed, then again they're going to turn around and they're going to tell their friends and their families and their neighbors, go to Jewish Hospital, because this is where you're going to be treated well. This is where you're going to know everything and you're not going to have any surprises. They can call themselves. Insurances have long understood the value of having screening colonoscopies, and so anybody can call the phone number. It's 210-4497, and that's going to be either me or Olena, and we will schedule them directly. We have Jewish Hospital downtown. We have Medical Center East, Jewish Hospital East, off of Breckenridge Lane. We have Medical Center South, which is down in Bullock County. We have St. Mary's and Elizabeth on Bluegrass Avenue, and Jewish Hospital Shelbyville.